Hey, deserving listeners, this is Chapter 4 in my deep dive on limerence. In Chapter 3, I went into detail about the signs. I briefly described the signs of limerence. I also went into full detail delineating between what I would like to call pathological limerence and normal infatuation or having a crush. And I hope that I, especially in the patron zone, convinced y'all that limerence is not just a normal, healthy, typical experience of falling in love or liking someone or being infatuated with someone. It is entirely different from that, and it has all the hallmarks of any other disorder in the DSM, the clinically significant distress, the impairment on life, that kind of thing, and it can last for years. So I thought in this episode, I would start talking about the symptoms in detail, and I will introduce myself. My name is Dr. Kirk Honda. I'm a therapist and a professor, and this is the Psychology in Seattle YouTube channel and podcast. I've been doing this for 17 years if you're new to the podcast or YouTube channel. And as is typical with mental disorders, we will categorize the symptoms into 4 broad categories, which I will do here. We have cognitive symptoms, we have emotional symptoms of limerence, we have behavioral symptoms of limerence, and we have somatic or physical symptoms of limerence. So we're going to talk about cognitive symptoms first. There are a number of categories of cognitive symptoms. The first symptom that I want to highlight is the intrusive thoughts. This is the hallmark of limerence. So this is the constant, uncontrollable preoccupation with the limerent object. So these are thoughts that enter the mind involuntarily for the most part, and they're constant, they're uncontrollable, they're frequent, and they're unwanted typically. The thoughts intrude throughout the day and are difficult to dismiss, if not impossible. So as a way of driving this home, I want to read some of the quotes from the respondents to the survey that I sent out that specifically asked for these people who have or are experiencing limerence. I asked them what their experience is of intrusive thoughts. So I didn't just ask, have you had intrusive thoughts? I asked, what's it like, right? And the vast majority of the respondents to the survey indicated they did experience intrusive thoughts. Like I said, one could argue that without the intrusive thoughts, then you probably don't have limerence. You probably have something else. So just to give you an idea of how often the intrusive thoughts were occurring and for how long they were occurring, in the first survey I asked how often, I asked an open-ended question, a qualitative response of how often did you think about the limerent object? And 60%-ish on the survey said that it was constant, some version of constant. Now, when I say 60%, I'm not saying that 60% of people with limerence have constant intrusive thoughts, because this survey wasn't designed to get at a generalizable percentage, but it gives you an idea of the experience for people with limerence. And on the first survey, it could be argued that there were a number of people who responded to the survey and said, yes, I have experienced limerence, when they didn't necessarily have what I would call pathological limerence. But at the very least, most people who experience limerence will report having a constant level of intrusive thoughts, and that constant level is not just for a week or two, it can be for years. So just think about that. Or it can be off and on for years, like most of the days of a year for 5 years, that kind of thing. Maybe there's a couple good weeks in there or a couple good days. Good meaning that it's not a constant level. So to provide some quotes to really drive home how constant the thoughts are for people, here are some quotes. One person said, "Every waking moment, during the most exciting part of a movie, during funerals, talking to friends, it was always present." End of quote. So this is very indicative of what I've heard, what I've learned, is that the intrusive thoughts are all the time. This person is saying during the most exciting part of a movie, right? You're in the throes of a really great movie and it's all the things are happening and you're really into the story. And yet you have this intrusive thought or this awareness of that person's out there. Do they like me? Or they sent a text, 2 weeks ago. That means, or they haven't texted me, or what's going on? I wonder what they're doing. Just that again, most of us can relate to those feelings that you have in the acute phase of having a crush or having an infatuation with someone. Well, imagine that ratcheted up to 10 times the intensity and frequency, and have that happen for years. And because I say that because if you just fell in love with someone and later that day you were watching a movie, then you might have a constant awareness of like, oh my God, I've fallen in love with this person. Even if they're not sitting right next to you, we could expect that. It's not always the case, but maybe for some people it is, many people it would be. Well, imagine that happening with someone that you're not in a relationship with, that you might not even know that well, and you're having it 5 years down the line. Okay, so they're saying during the most exciting part of a movie, during funerals, talking to friends, the intrusive thoughts, the thinking about this person was always present. So constant, every waking moment. Another quote here, 24/7, 365, from waking up until going to sleep, hours upon hours of daydreams, end of quote. So some of you might be thinking, what? Why? Why would you be, even if it was a normal infatuation, 24/7, 365 from the moment you wake up until you go to sleep? Why would that be? Well, there's some good theory that indicates that this is closer to OCD or to addiction than it is to having a crush. It's the addictive part of the brain that will get addicted to the crush process. When I get in a later chapter, I'm going to go into detail. And when I revisited the brain science around addiction and refamiliarized myself with the science around this sort of stuff and applied it to Limerence and applied it to what I was learning for people, it really clicked. I'm not saying that it's just an addiction, because that only explains, I think, about half of it, but it's something to keep in mind. So when you think about someone who is in the throes of addiction to heroin or cocaine or something, I think most of us understand that for those folks, it can be constant. It can be 24/7, 365. That they're either thinking about using soon, or they're thinking about how they're going to get some to use, or they're thinking about how they're going to get money so they can buy stuff so they can use, or they're thinking about having just used, or they're thinking about, oh no, what happens when I come down from my current high and I have to, it's just a constant compulsion, a constant obsession. Another quote here, almost every second of my waking hours, it was excruciating to feel like I was not able to think about anything else. Another person, all day, I imagined they were with me in every moment. So this person is highlighting the intrusive thoughts, the constant thinking about the person had to do with imagining them with them. Another person, constantly, even with set intentions not to. I said that funny. They're like, even when I was trying to push back on the thoughts, it was constant. Another person, all caps, all the time. And then they say, on the occasion I was distracted, but as soon as the distraction would cease, he would pop into my head. So I think they're saying on occasion I became distracted. So there's, occasionally I would get distracted from the thought of him, but as soon as that distraction ended, immediately he would pop into my head. Now, a smaller percentage of people, again, this isn't extrapolatable into the general population, but at least on my first survey, about 25% of people responded to this qualitative question with less than constant, but very frequent. So I'm categorizing this as, daily, but not constant. So one person said, at least 10 times per day. Another person, every day, multiple times, cyber stalking them, strolling by their place of work. Another person, every 6 hours at a minimum. So this still sounds like constant, right? But in terms of the responses I was getting, it seemed lesser than constant. Now, maybe they meant constant, but when I hear people saying every waking moment or 24/7, 365, or almost every second of my waking hours, right? That sounds different than at least 10 times a day or every 6 hours at a minimum. Now, in this category, which captures a pretty big chunk, when we include of the responses that I'm categorizing as constant, plus those people that are saying daily, we're talking about 85% of the respondents. And again, as I was saying earlier, there's a chance that the rest of the 15%, if I were to actually ask more questions in terms of my criteria for pathological limerence, I might not categorize them as experiencing pathological limerence because it wasn't as invasive and debilitating in their life. It might have been very hard for them to pine for someone, but it wasn't at that pathological level that was ruining their life. Maybe not, I don't know. I'm still trying to suss that out as to whether or not the criteria for what I would advocate to be a category of disorder of pathological limerence. I'm still debating whether or not the number of times the person thinks about the person, or the frequency or the amount of time spent during the day having intrusive thoughts. I'm still debating whether or not that should be a criteria, because for some people with limerence, it will be intense, for say a couple days, and then not intense or kind of not even noticeable for another 5 days. So does that qualify as limerence or not? That wasn't typically what I would hear, but we just don't have enough research to answer these questions yet, I don't think. And then about 10% responded with answers that were more intermittent. So sort of like the 2 days on, 5 days off. Here's a quote. I'd go months without thinking of her, then have periods of months of daily thoughts. So there's that cyclical nature. Another person says once a day or every other day. Okay, so this doesn't sound like constant. It doesn't sound daily, right? Once a day or every other day. Another person, sometimes every day, sometimes a few times per week. Sometimes I would go a few weeks without thinking about them. So again, intermittent. And I would be curious about these respondents, about how they experience the overall experience that they are framing as limerence. And I want to be clear that there is no clinical established definition of limerence, or at least it hasn't been, there's no consensus because there's so few people talking about this in the clinical world. So any of the respondents can say that they have limerence and define it however they want to. So I'm not saying that anyone's wrong or anything here. But I am in this deep dive advocating for a tightening up of the definition and the criteria, and I'm advocating for recognizing it as a pathology because it certainly sounds that way to me. Okay, so on the follow-up survey, I asked for their experiences of the intrusive thoughts to really fully get a feel for what it's like to have these. So let's get into some of those quotes here. There were many accounts describing how the limerence takes over their mind and how they lose control. And here are some quotes around that. It felt like a horrible weight being dropped on my back. I'd have panic attacks about them for no reason. So they're saying I would have panic attacks about my limerent object for no reason. So horrible weight, that sounds involuntary, right? It's like they don't have control over it. Another person says, all day, everything I do and say is filtered through their lens. What would they think about this? What would they say? So this is another angle to the intrusive thoughts that I haven't highlighted yet, that the limerent person is obsessing regarding how would my limerent object see this? How would they feel about this, right? So that can be another element. Another quote here, I would usually start to fantasize about the person as a form of self-soothing, Over time, I lost control and the fantasies took up more and more time. End of quote. So this person is highlighting another common experience where in the beginning of the limerence course, in the beginning phase, the limerent person or the pre-limerent person has some control over the thoughts and are actively, volitionally fantasizing about being with the person or about having sex with the person. But over time, the individual will lose control over those thoughts, and then they become intrusive. They become needed. They become an itch that can't be scratched, or that can only be scratched through fantasy or something like this. Another group of responses regarding intrusive thoughts had to do with how it felt like an addiction. And here are some quotes. The intrusive thoughts, they were obsessive. I didn't want to stop them because it was such an incredible high feeling. So this person is saying the thoughts are obsessive, and honestly, I didn't want to push back on them because the thoughts gave me a high. Another person, I would describe it as a virus that took too long to run its course. A virus, again, it evokes involuntary invasion of the thoughts. Another person, when I asked, what's your experience of the intrusive thoughts? They said, it was both debilitating and invigorating. I did not try to stop them because the validation and feeling desired by them was addicting. So I didn't try to stop the intrusive thoughts because the validation was addictive and the desired feeling, the euphoria of the fantasy or the thought of this person became an addiction. Another group of responses were talking about how the intrusive thoughts were exhausting and would cause anxiety and would cause physical symptoms. This person says, when asked about the intrusive thoughts, their experience, they're saying it was extreme emotional burnout. Physical burnout felt very similar to come out of. Meaning that physical burnout that they had experienced was very comparable to the burnout of the intrusive thoughts. Another person, it felt like mania, euphoric, angsty, yearning, and sad. Another person says, it doesn't go away, it's hollowing, meaning they feel hollowed out by the intrusive thoughts. Another group of people said that they recognized that the intrusive cycles were a reflection of a deeper wound. And here's some quotes. It was simply the most important thing happening in my life. I needed to go through this to address healing and the deepest emotional wounds. Another person said, my husband actually has OCD, and the experience of limerence seems to have some overlaps with what he experiences. So later on in the deep dive, I'm going to delineate between OCD because it is, in my opinion and most experts' opinion, different, but very, very similar. So when I asked this question, I asked a follow-up question to get at how difficult and how involuntary the intrusive thoughts were by asking the question to the respondents, how did you manage? What did you do to try to stop the thoughts? Because I thought that would get at just how entrenched or how compulsive or how obsessive these thoughts were. And there were a group of people that were that would avoid the thoughts or avoid the person or would try to block the person online. And this person says, I blocked him on everything, meaning social media, right? I blocked him on everything and moved on without letting him know. Other people talked about distracting themselves or redirecting themselves. And here's a quote. I tried to busy myself with tasks around the house. I cleaned obsessively. Going on, another group of people talked about trying to just accept, through mindfulness, radical acceptance, just be like, I'm not going to fight it. I'm just going to allow it and then let it pass by. And so this person says, I'm learning to stop and exercise mindfulness when these thoughts begin to be exhausting or stressful. Another group of people talked about using creativity to recover from the intrusive thoughts. And they say, create art, music, writing, and finding an outlet for the intense feelings. So that's their response to how they managed the intrusive thoughts. Other people talked about therapy or going through a recovery program. This person says, I went to SLAA meetings every day and did the HOW 12-step program, and the thoughts subsided. So without getting into the weeds, they're talking about a 12-step program to help them to recover, and they went to meetings every day, and this helped them to stop the intrusive thoughts. So I hope that a quote like that really drives home how involuntary the thoughts are, right? That someone would try to stop, they can't stop. They take measures to stop. They try to distract themselves. Nothing is working. So they have to go to a 12-step meeting to stop, and they have to go through the program. They have to go to therapy. They have to recover, right, before these intrusive thoughts will subside. Other people would seek medication or would take a supplement or something. This person said, I started taking the supplement NAC. Over time, the urges faded. Another person tried to use behavioral techniques. Some people were talking about that, and one person said, I tried rubber bands until I started bruising. End of quote. So there's this technique that some people will use. There's, spotty evidence of its effectiveness, but for some people it can work. That every time you think about something you're trying to break the habit of, you cause yourself pain, and that sends a signal to your brain to not prefer that thought, right? To try to distinguish that thought. So the thought or the fantasy, the intrusive thoughts, this person would take a rubber band and would snap their wrist with it probably, and in the hopes of the intrusive thoughts would naturally go away. There wasn't anything more in the quote that indicated that it worked or not, but that was something that they did. When I asked, what have you done to try to manage it? I didn't ask what worked. I just asked, what did you try? Another quote here: the only thing that helped was the loss of hope in time and distance. So they're saying, I'm implying, or I'm inferring in their response here that they did try things and it didn't work, meaning that they tried to push back on the intrusive thoughts and it was to no avail. But with time, with loss of hope, meaning an acceptance of reality that I'm not going to get reciprocation, and with distance, I don't know if that's emotional distance or physical or both, that the intrusive thoughts naturally went away, which is reported by people, that with time, with distance, with acceptance of reality, eventually the intrusive thoughts will just kind of naturally distinguish themselves or extinguish themselves. That isn't always the case, but okay. So those are some of the responses to the question of what was the intrusive, how did you experience the intrusive thoughts? All right, let's take a break. When we get back, we'll continue with the cognitive symptoms. All right, we're back from the break. So the next cognitive symptom that is basically universal for people with limerence is that they will experience fantasizing and daydreaming. So in the clinical literature, sometimes we'll delineate between fantasy and daydreaming. It's not critical that we do so in this deep dive, but I do want to add some aspects of fantasizing and daydreaming that might illuminate this, that there are active fantasies that we can engage in where we choose to imagine something. Like all of you right now can fantasize about winning the lottery, right? You can fantasize about winning it, what it'd feel like, what you would buy with the money, that kind of stuff. So, we could consider that fantasizing or fantasizing sexually about someone, right? And people with limerence will engage in this active form of fantasy. There's also the involuntary, intrusive fantasy, the kind of needed fantasy, like if we, again, go to addiction, that if you are deprived of drinking and you suffer from alcohol use disorder and it's in the morning and you're craving alcohol, and so you start thinking about, okay, when I get home from work, I'm gonna sneak out and get this. Maybe that's a fantasy version. That kind of thinking into the future or imagining that kind of stuff. People with limerence can have that kind of intrusive need to fantasize. There's also passive, what I would call daydreaming. There's maladaptive daydreaming, where you slip into daydreaming and it's not voluntary. It's something that it's almost dissociative, but not really dissociative, where you're drifting away from reality, and then 45 minutes into the daydream, you suddenly realize, oh my God, I've been sort of daydreaming this whole time. That's different, I think, for most people than this active fantasy. So I'm kind of going to lump / delineate between these two. So with fantasy and with daydreaming, these are defined as vivid mental imagery about being with the person, sometimes deliberate, sometimes intrusive or involuntary. In this way, the mind creates detailed stories of connection and future union. So let's go into the quotes from people regarding fantasy and daydreaming. So in summary of the follow-up survey responses to the question, tell me your experience of fantasizing, the participants across the board, for the most part, described their active fantasy, meaning that, because I defined it in the question that it's active versus the inactive daydreaming. So they're focusing on how it was active. And they said that it was an intentional construction of an imagined intimacy between them and the limerent object, and that they engaged in this intentional imagined fantasy of intimacy to provide them with the euphoria of the emotional hit that occurs. It's like the hit from the crack pipe smoking, that kind of thing. It's that euphoria that you feel when you get your hit. And people described it as that the fantasy gave them that wash of euphoria that you get from drugs and substances and falling in love. And they also did the fantasy to have some control because they felt out of control. They also did it as a temporary relief from the longing, right? They're yearning for this limerent object and they can't get to that person. And so by having a fantasy, they could get this temporary relief and live in a fantasy world where they actually are with the person. But they also described using the fantasy as a temporary relief from other things, sort of the effects of the overall limerence, like the shame of the limerence or the exhaustion or the despair, that the fantasy would distract them from that. And if this sounds like an addiction, that's because it is seen by many as a form of addiction or very similar to that. People will smoke weed or drink alcohol or use heroin or something, or gambling or shopping or whatever, or pornography and masturbation as a distraction from shame, from the despair of life, right? And people in their limerence, in their active fantasy, the thing, the thing here is it really voluntary when it's an addictive cycle, right? In a way it is, but in a way it's not. So let's get into some of their quotes. But first, let's take a break. The rest of this episode will be for patrons of the podcast. I want to reward those patrons for literally paying my bills and giving me the ability to spend weeks and weeks of 16-hour days on this topic to look into it and prepare for this series of lectures. So if you want to hear this whole episode, I'm going to go into all the quotes and everything. Is could be a 90-minute or 120-minute episode. But if not, then take care of yourself because you deserve it. You really, really do.